Good afternoon, everyone. Thank you for joining us. We'll begin shortly. We're just waiting for all the participants to come into Zoom. Good afternoon, everybody. If you're just joining us, we will begin shortly. We're just kind of watching as the participant numbers go up, filtering people in through Zoom, and we'll probably start at about 102, 103. Okay, it looks like slowing down to a bit of a trickle now, so I think we can go ahead and get started. Thank you for joining us, and I'm going to turn things over to our Executive Director, Chrissy Giuliano.
Thanks, Elizabeth. Hi, everyone. As Elizabeth said, I'm Chrissy Giuliano, Executive Director of the Big Cities Health Coalition. Thanks for joining us today. We're excited to discuss both our vision for the future of public health with you and to share some real-world experiences from our members. Just so everybody knows, we will make the slides and the recording of the webinar available to everyone who registered, and it'll be up on our website. So both of our guest speakers today come from one of our long-standing active member health departments, Maricopa County Public Health, which serves Phoenix and its surrounding areas. Daymude and Tiffany, Tu, both specialize in community health impact at the Maricopa County Health Department. We're delighted to have them with us today to talk about their innovative program to collect and learn from their community's experiences, the COVID-19 pandemic. So I'm going to start off with just a little bit of background about Big Cities Health Coalition and our vision for the future of public health, and then I'll turn it over to Annie and Tiffany. So BCHC was started more than 20 years ago to convene leaders of the country's largest metropolitan health departments on the premise that there's something unique about urban health and about being a big city health commissioner. We've since grown to 35 members who together serve about 1 in 5 Americans. Our work as a coalition focuses on sharing best practices, like we're going to do today, strategizing on how to address complex urban health challenges, and advocating for urban health, health equity, and the public health field as a whole. This webinar series is designed to introduce our urban health agenda and show how its core ideas can be put into practice. So we'll discuss a few key concepts today. And if you'd like to learn more, you can visit our website. The image on the screen shows you where to find it, and you can also scan the QR code to be taken there directly. So our urban health agenda rests on the idea that protecting and promoting the public's health requires more than healthcare, or even what we traditionally think of as health. To achieve truly healthy, safe, resilient communities, we need things like full employment, livable wages, earned sick leave, safe, affordable housing in neighborhoods that have access to healthy food and public transportation, and safe, appropriate K-12 education, parks, and green spaces. This comprehensive cross-sector approach works only if we also dismantle structural barriers and systems that are built on generations of racism. Inequities are baked into too many of our institutions, laws, and policies. This means we have to do better than just change programming in our communities, but also change structures and practices. We have to work with our communities, especially those that have experienced the most discrimination and the least healthy outcomes, to determine together what will create lasting health and resiliency. We also have to advocate to dismantle systemic barriers so that everyone in our communities, regardless of where they live, work, or play, or their race, ethnicity, can live their healthiest life. In our vision, all government agencies and relevant community-based organizations work together to promote and protect health and safety. Public health departments can and often should sit at the center of decision-making processes about community health. However, while health departments play an important role in protecting and promoting the health of their communities, no single entity can improve the health of the population. To be successful, these efforts require collaboration across all local government agencies and with elected and appointed officials and community-based organizations. So how this all comes together sets the stage for today's speakers. We're going to hear a little bit more about taking a community needs assessment to a deeper level. We'll see how the health of communities can become even stronger when health departments don't just provide services, but develop goals and practices in a truly collaborative way with the community. So with that, I'm going to turn it over to Annie and Tiffany. Thanks again for being here with us today.
Hi, everyone. Thank you so much. We're so grateful for you all asking us to come and speak today. Really excited to share with you all our Voices of Maricopa County dashboard, the process of conducting a health needs assessment that really centers community voices and what we've been doing with that. Next slide. So a little bit about ourselves. My name is Annie Daymude. We both come from Maricopa County Department of Public Health. I work with our community health team to lead the Synapse Coalition, which is a group of hospital and healthcare partners who partner with the public health department to better understand the needs of our communities and make strategic health improvement plans, both on the public health and the hospital and FQHC level. I'll turn it over to Tiffany to introduce herself.
Thanks, Annie. Hi, everyone. I'm Tiffany Tu. I'm a community health impact specialist here at Maricopa County Public Health. I also support the great work that our Synapse partners partake in regarding the community health needs assessment. I also support a lot of that work here at the county as well. So excited to be here with you all today.
Wonderful. So as we spend some time together today, our objective is really to share the why, how, and so what of the Voices of Maricopa County dashboard development. So one of the big things that we have seen as we've assessed the needs of our community and the strengths of our community is that people have so many stories to share. So this next slide is a quote from one of our participants who had visited our dashboard and provided feedback on all of the stories that they were able to see. They said, there are so many stories to be told and many that may never be heard. And that's something that we were just really inspired by and have really taken to heart, and feel like that captures a lot of the work we do as we do these surveys and focus groups and try to understand how it is that we can build a community of better health and well-being for our residents. Next slide, please. So as we kind of get into the structure for the work that we do here at the health department, all of it is in partnership with the community. As the health department, we serve as the backbone agency for a few coalitions. One is the Synapse group, which I mentioned just a moment ago. Synapse is a group of hospital and healthcare partners that come together. It started in 2014 to conduct needs assessments. So recognizing that across Maricopa County, we are the second largest county following Los Angeles County in the US. We have over 4.5 million residents. So there is just a lot of people to try to understand and get a sense for what can be done to help people live healthy lives. So many of our hospital partners, such as Mayo Clinic, Banner, Valleywise, Native Health, have all come together in a collaboration to better understand those needs and to create plans that are in parallel. Now, our Health Improvement Partnership of Maricopa County, that's our kind of grassroots group of community partners. So those are our health coalitions, our school boards, our nonprofits that really have that emphasis on bringing community voices to the table and working on strategic improvement plans as a result of the needs assessment data. This collective movement is something that we've branded maricopahealthmatters.org, and all of it really centers around our community sectors and partnerships. So as I mentioned just a bit ago, Maricopa County is huge. There are so many residents, such a great amount of diversity in our county. So one of the ways that we have worked to try to give get the best understanding and implementation of work is we've recently regionalized our county. So within the county, we have 5 different regions that kind of splits up the population so that we have liaisons who work with each region. We do a lot of our analysis by region, data collection by region, just to make sure that we're targeting folks that live outside of the city of Phoenix. As you can imagine, Phoenix is kind of the hub of a lot of our population, but we have residents that live all across the county. So next slide. So as we've done 5 rounds of community health needs assessment data collection, we have really seen a lot of improvements and made a lot of intentional improvements in how we collect that data. So as you'll see, in 2012, we had a survey, we had focus groups, we provided it in English and Spanish, and only a paper format. As the years went on, we provided grants for outreach to community partners to help us collect more diverse data. 2019 introduced a virtual format for the survey and that regional approach that I had mentioned. And then in 2021, we were able to administer the survey in 13 different languages. And in 3 weeks' time, on March 1st, we're about to launch our 2023 survey. It's going to be the biggest and best one yet. We have all these different features available. We're really targeting a diverse representation and getting really quality data from our community. Next slide. You can also see as we've moved along, we've really gotten a lot of increased participation from just under 1,000 in 2012 to over 14,000 in 2021. We always take a multifaceted approach. We have a survey, we have focus groups to really kind of go more in depth to understand the perspectives and the thoughts of the community. You'll notice in 2021, we had a lower amount of focus group participants. That was peak COVID and vaccine rollouts. So we have shifted our participation to be virtual, and that's why you'll see a lower number of our focus group participants there. Next slide. A lot of what we do when we look at the data that comes in is highlighting our major community trends. So we'll see that there's top health issues and top social issues and how those have changed over time. For example, between 2019 and 2021, alcohol, substance abuse, overweight, obesity, and mental health issues were identified by the community as the top issues that had a major impact on their community. Unsurprisingly, we saw mental health rise from number 3 to number 1 in 2021. We imagine largely a result of the COVID-19 pandemic. With top social issues, we see distracted driving, homelessness being some of the top issues year to year. In 2019, illegal drug use was also identified as a top social issue. And then in 2021, lack of people immunized was identified as a top social issue. So seeing these trends either kind of stay similar or change over time really helps us as we direct attention, resources, funding, those types of things. One thing you'll notice here too is a top issue that did actually not make the top 3 cut until we broke out the data by race and ethnicity. And that top issue is racism and discrimination. Among several of our participant demographics, racism and discrimination was the #1 social issue that affected the community. And so that kind of brings us to our next point with the next slide, which is the importance of diverse representative data. So this past cycle, we saw underrepresentation from Hispanic, Latinx, African American, Black, and male individuals. This graph here shows in light blue the percentage of the Maricopa County population broken down by race and by gender. And then the dark blue bars are the percentage of our survey responses. So you'll see we had predominantly white, predominantly female respondents. So this is something that we are really paying a lot of attention to as we launch our next round of data, trying to get the most diverse data we can so that some of our populations that have kind of not had their voices and their input come to the top in the past really are able to share that information and share their experience. As you see, we had some underrepresentation in this cycle. So one of the ways that we really tried to lift up those voices was through our project with this dashboard, which really dove into qualitative data. So in the next slide, we'll see some of the different qualitative themes that came up. And to give a little background, the CHNA survey is majority multiple choice questions, asking things like, how would you rate your health? Or what are the most important issues to your health or in the community? But we had one question at the end that said, what else would you like to share? And out of the over 14,000 people who filled out this survey, 4,500 people, so almost a third of the people, chose to write down anything from a short comment to truly paragraphs about what they had experienced. We knew this was just a wealth of data, and so we tooled up our team in qualitative analysis. Several of us had some extensive research background in that, and we had a team of 6 individuals go through the survey, those open-ended responses to do a thematic analysis. We found so many themes, everything from vaccine experiences and opinions to information and news coverage, impact to business and economy, the type of things that's difficult to really investigate in a traditional health survey, but that had major impacts on people's lives. We saw so much of this rich data, and we thought, you know, it's getting folks' voices and experiences out there is so important. We can look at the quantitative data, the death records, incidence of disease, to show us what the issues are, but not the context of what to do. And so that's really where our qualitative data comes in, and the purpose of our Voices of Maricopa County dashboard, which I'm going to pass over to Tiffany to dive into.
Thanks, Annie. So with all this collected data, we really wanted to bring this data back into the community in a really interactive way. Whereas we typically have created reports and profiles, but these reports might not necessarily be relevant to the community. So we want to bring it back in a way that they can easily engage and easily understand the data. So with that data, we collaborated with My Sidewalk, a interactive data platform, and we developed the Voices of Maricopa County dashboard to really lift up those community voices and demonstrate those prominent health needs through immersive quotes, as well as through that data that was collected through multiple sources. This dashboard includes data from 14,380 survey responses from our COVID-19 impact survey that was from 2021, as well as 4,500 open-ended responses that Annie was speaking to earlier. And in addition to that, there's also data from 33 focus groups that were conducted in 2021 from our COVID-19 impact focus groups, as well as population health data from multiple supplementary sources. This dashboard is also largely driven by 8 top themes that really rose up to the top based on shared community experiences in Maricopa County. And some of those top themes include social determinants of health, COVID-19 prevention measures, access to healthcare, chronic disease, and mental health. And there's many more. There's a total of 8 themes. And so we've also included a QR code on this page, which will take you directly to our dashboard if you're interested in exploring that with us. So one of our most prominent themes that rose up to the top from our community survey was mental health, as it was significantly exacerbated by the pandemic. From our dashboard, we provided a snapshot here, which really showcases how we've integrated multiple data sources from community surveys, focus groups, as well as data that's been retrieved from the CDC and even Burfus. So on the left, you'll see mental health as the top theme, and then you'll see the drop downs right underneath mental health, which are really the sub themes that came up pertaining to the overall theme of mental health. On the right, you'll see an interactive map, which shows the percentage of poor mental health among adults, and participants are able to users are able to really hover over the map and see the different percentages that vary across Maricopa County pertaining to that topic. On the bottom, you'll see a little excerpt with little context about, the community's experiences, as well as some of their community's voices that were shared with us on the survey itself. So as you explore the dashboard, you really find most of the pages are designed to depict the top themes, sub-themes relating to the topic, along with supplemental data that's been described here. So the Voices of Maricopa County is a live platform that's really filled with stories, really stories that shape our perceptions and elevate those top health and social issues faced by our community. As Maricopa County residents are continuing to share their stories, this is a live dashboard, so they're still able to go into the dashboard and share their experiences, whether if they've been impacted by COVID or if it's even real time now. We're really still working to keep listening to the community and really learn from those lived experiences as we work to serve our community alongside with our partners. So community empowerment, continuous collaboration and partnership with community-based organizations really becomes the foundation of achieving more healthier and equitable communities. At Maricopa County Public Health, we're really shaping the future of health by first centering community voices, from data tool developments to results reporting. So we recently conducted 2 rounds of survey pilots with about 12 various community groups, 85 participants, which gave feedback about each of our survey questions that'll be launching in March, as well as the usability of the tool itself. So this great feedback, conducting these survey pilots has really helped us ensure that our survey tool is relatable to our community as well as understandable to them. So when it comes to data reporting, it's really important to not only acknowledge the community's experience, but also including their voices in the results as well. Second thing is promoting opportunities for continuous feedback, connection, and partnership. So we really want to highlight our collaboration with the Health Improvement Partnership of Maricopa County, or HIPMC. And based on the collected data from our CHNA, we want to feed that data back to our community partners. So they really have that data justification as well as those compelling stories to better identify and address those community needs. For example, if Valley of the Sun United Way sees that access to food is a priority issue, whether or not it's their specialty, they can still have greater opportunities to connect folks to resources because of their connection with the HIPMC coalition. And the final thing here is really prioritizing community input in public health and in healthcare strategic planning. So in the past, we focused primarily on quantitative data collection in our community health needs assessments. However, most recently in our 2021 COVID-19 impact survey, we've opened up an opportunity for the community to share their voice and share their experiences. And many of those voices were highlighted when sharing that data back into the community. Community input is also prioritized when we collaborate with our Synapse partners in creating their community health needs assessment. So for example, with Mayo Clinic, when we prioritize health needs and support them with developing their strategic plan, this process typically involves the integration of data and stories from surveys, focus groups, along with health indicator data. And we've really received great feedback from our partners that the supplementation of qualitative data analysis really helps with data contextualization. So Maricopa Health Matters is our main hub for all data reports, dashboards, and profiles. We invite you to continue exploring the Voices of Maricopa County dashboard along with the data that's been collected from past community health needs assessments on our page. If you're interested, you can also stay informed about our upcoming CHNA survey that Annie had said will be launching on March 1st. So we're super excited about that. We've also included our emails on this slide, and if you have any questions, feel free to reach out to us. And in the meantime, we'll stick around if you guys have any questions. Thank you.
Great, thank you so much. We have had a few questions start to come in, and definitely feel free to continue to add your questions to the Q&A feature. And if you would please, I forgot to mention this at the beginning, just tell us where you're hailing from so that we have some sense of context. So our first question is whether it's possible to see the 2023 survey that you all distributed. I'm assuming they mean the actual questions.
Take that. Yeah, so we're about to be launching the survey March 1st. So we're still working on, we finalized the questions, we're working on translation, but the survey won't be published until it goes live, beginning of March. So we would recommend that if you're interested in kind of keeping updated on that survey when it comes live, if you live in Maricopa County, please take the survey when it comes out. And if you don't, but you're just kind of interested to see what the questions are, what the methodology is, you know, you can sign up for updates. The link that I just provided brings you to maricopahealthmatters.org. So you can sign up to receive updates. I will say, if you're interested in seeing the questions and you don't live in the county, please don't go through and take the survey. You can reach out to myself or Tiffany. Our emails were provided, and we'd be happy once it's published to send you a copy of the questions. But just, you know, for data integrity, we want to keep it residents only.
Yeah, absolutely. Sort of a related question from Brianne Agate. What was your methodology for survey collection? And is your sample representative, or was it more of a convenience sample of obtaining responses from as many residents as possible?
So with the sampling, we've done a convenience sample. So that's where, when we kind of looked at the population proportions, that's kind of our way of trying to get the best representation we can. We have internal cutoffs. So for example, if we have folks that are in like a certain demographic that's like less than 5, we're not going to ever publish that information. If the denominator of a certain group is less than 20, but between 5 and 20, we might publish it, but provide asterisks of that data. The reason it's a convenience sample is because as a needs assessment to inform the community, we want to provide all residents the opportunity to take it. And then we really bring it upon ourselves through our grants, through our strategic outreach and partnerships, to really elevate and increase the participation from the groups that have been historically underrepresented. So we do weekly monitoring of responses by race, age, region, zip code to see where we need to target further outreach while the survey is open for those 3 months. And then we do plan to do a weighted analysis at the end to compensate for any of that over or underrepresentation.
Gotcha. That makes sense. These questions are sort of like just kind of nicely following on each other. Here's another one in the chat. If you all wouldn't mind putting your questions in the Q&A, it'll be easier for me to follow them, but I'll ask some of the ones that I see from the chat. Can you share what your successes were with primary qualitative data collection? It's a big question, but
I'll go, and Tiffany, feel free to jump into. So one of the things that we've historically always done the focus groups as our main primary data collection method. And we, you know, are familiar with kind of working with that format. My understanding is that this is the first year we've like really done that in-depth dive into the survey generated qualitative responses. So Tiffany, do you want to share a little bit about what it looked like for us to how we, you know, kind of rolled out the data collection and why we think we probably got the good responses that we did?
Are you referring to kind of our analysis process, or like how?
So some of the data, like the kind of events that we went to, those kind of things.
Yeah, so our data collection process really looked like going to vaccine events, since the COVID-19 impact survey was during a time when COVID was just really just introduced. And so went to many vaccine events. We went to we also partnered with a lot of our community-based grassroots organizations. And so they would have different events that are targeted towards their populations that we would also attend as well, to really get that representative voice from the community, to collect a lot of that feedback as well.
gotcha. Our next question is from Yuri Benella, who asks, does the dashboard provide zip code level data that comes from the CHNA?
So the Voices, I can take that one. The Voices of Maricopa County Dashboard does not provide zip code level data. However, there are some supplementary maps that are included on there that have an overlay of Maricopa County that's also broken down by zip code. based on the topics of each of the themes. But when it comes to data that's particularly from the CHNA, we don't have zip code level data on the Voices dashboard.
So we've also had a couple of questions that are more related to the Synapse partnership and your work with healthcare systems. So one person's asking, how did you get the Synapse partnership? Any suggestions about how, I think, they're sort of looking for suggestions about like tools and tricks for kind of making that happen in their own community. And then we had another question come up about what the role of healthcare systems is in your implementation plan for this survey. So kind of two sides of that relationship.
Yeah, that goes together really nicely. So our Synapse coalition's been around since 2014. It came about with the advent of the requirement in the Affordable Care Act that all nonprofit hospitals and federally qualified health centers conduct a needs assessment every 3 years to kind of get that bigger vision of what's going on in the community and integrate more preventative services as opposed to just more of like the disease management approach. So what happened is that when that requirement came out, several of our local hospitals and agencies, including the Mayo Clinic, including Dignity Health, and several more of our FQHCs actually approached the health department and said, y'all are really accustomed to doing this kind of data work, this kind of, investigation and reporting. How can we work together to kind of collaborate in this regard? Another thing too with Maricopa County, as I think with many of our, big urban centers, is we have a lot of healthcare providers right in the same area. So you have a big overlap in market share. You have a big overlap in population. We currently have 8 different partners, agencies, and each agency typically has, anywhere from 2 to 10 different locations. So if each of them were collecting their own data, you'd probably see a lot smaller sample size. You'd see a lot of overlap too and over-surveying of these populations. So since 2014, we've worked together. One of the really neat aspects of this model is that our healthcare partners, they have a contract with the county. So they actually, they do pay into a pot that supports salary of some of our staff. It supports data collection efforts because you do see in turn that that financial benefit that goes back to the hospitals being able to retain their tax exempt status. What we do is we work together with data collection. So one of the things that we have our healthcare partners really participate in is getting the word out. So in their clinics, putting up flyers and posters about asking people to take the survey. We do really ask them to utilize their networks, not only of their staff, but of their clients to take the survey if they're interested in doing so. And then we, as the county, we work with each partner kind of individually to help them create like a tailored health prioritization. And then they take that to do an improvement plan. But because we work together and even outside of data collection, we meet monthly to collaborate and to connect. What we really love seeing is that there's a lot of synergy around the improvement side of things. So you might see a hospital like Phoenix Children's Hospital who, focuses in pediatrics, acknowledge or recognize that there's a big need for affordable housing. And that's maybe not something that they're able to provide, but they link up with some of our partners through the HIPMC to see what are those referral pathways that we can do. We've also seen a lot of our partners use the results of the needs assessment to allocate their community benefits dollars. So that's kind of the process we're seeing. We're always working to better integrate our communities. But it's been a very, very strong partnership, and we'd be happy to talk to, any other healthcare agencies or public health organizations to talk about it. I do feel like it's a great model to really, pull together the strengths of both the healthcare delivery world and the public health world.
Yeah, I mean, that does really seem like such a win-win, right? Because you talked at the beginning about how they have a need to establish that they can kind of continue to maintain their nonprofit status, but you also, most health departments do not have as many epidemiologists as they need. So kind of matching up those two needs together really makes a lot of sense. Let's see, another question that we had relates to funding. And I know that I suspect that some of the funding has probably come from, sort of COVID-19 specific dollars, but, if you, to the extent that you're comfortable talking about it, how do you sort of, how do you see the survey sort of continuing to move forward once the pandemic specific dollars start to disappear?
Yeah. I think that we've been collecting the CHNA data since 2012, so well before pandemic dollars were available, and a lot of that has come together from again the finances that our Synapse partners put in. This is as a health department with to be public health FAB public health accredited. It's a big priority of ours to do a regular needs assessment. It's something that's utilized by a lot of our different teams. So there's over the years, we've really had a ton of buy-in from our whole health department about this needs assessment. So we're able to utilize various funding streams even within the health department. We have really we've been able to use a lot of our CDC health disparities dollars to promote our local community organizations in their data collection, those types of things to really boost the participation this round. But like you said, we're in it for the long haul. This is a partnership that's been going on almost 10 years. We were committed to doing the work even when it was really kind of pulling it together as we could, and we are setting up systems now in those longstanding partnerships to help our community organizations, maybe that are just learning about a CHNA, get that buy-in to recognize how that data can be helpful for them. So a lot of that work we're doing is trying to take this this definite advantage in current funding, but to lay the groundwork for that long term through those partnerships and really having people understand the value of the work.
Our next question is about data you're not currently getting. So that person who posted anonymously, what data would be of value for your work that you are currently not getting?
I think we have, as we showed in that slide, kind of our underrepresented populations. If in an ideal world, we would be able to have so much data that we could really disaggregate a lot of it, that we could get really fine-tuned reports on our rural population of a certain age group, of a certain income bracket. So that's one thing that we're hopeful that we'll be able to get much closer to this year than we ever have before. One of our ways of collecting that better data is we have a much more comprehensive race ethnicity question where it really breaks down the kind of different race categories into specific ethnicities. So we'll be able to really, if we get sufficient data, to understand where it's coming from and break that out. Another thing is we've really improved our sexual orientation and gender identity questions to really be kind of the most updated gold standard of practice with a lot of input from subject matter experts, so that we'll be able to look into that data in a deeper way than we have before. We always wish we could ask people a million questions, but one of our big focuses is try to keep the survey tight. We have it currently, we're super proud. The entire thing is 5 pages, and that's just single-sided, 3 pages of rating and assessment questions, 2 pages of demographics. That race ethnicity question takes up a whole page. So it doesn't take that long. It just takes up a lot of space. And of course, virtually it's a little bit different. But even thinking back to the question about the qualitative data, we think that if we keep the survey short, people might actually still have the willingness to lend a few more minutes to write down additional thoughts as well. So there's always more stuff we would love to ask people, but it's that balance of keeping it short enough. Anything else, Tiffany, you can think of that you'd like to hear about?
Nothing different, but I just wanted to add regarding modifying our survey tool to be a little bit more inclusive, right? We got so much feedback from our 2021 COVID-19 impact survey that folks were not feeling included based on the questions we were asking or the question options that were provided. And so really getting that community feedback through survey pilots it's so rich, to be able to improve that data collection tool in order to, get a more representative sample from our community. So just wanted to add that piece in.
Thanks. Our next question is, how do you manage all these relationships, especially the community-based organizations or community leaders? Do you have a relationship management software system?
Oh man, it's a great question. It's such a team effort. I mean, we have really built out the infrastructure of our health department over the past several years, especially as we've kind of done this regionalization approach to really focus on that relationship building. So I can just say that Tiffany and I both are in the Office of Community Empowerment. And within our office, we have a group of, there's 3 of us specifically focused on our Synapse healthcare partnerships. We coordinate with EPI on the data side, and they're also connected with a lot of our data people in the area, as well as our research-related relationships. We have public health liaisons, so we have one designated for each region of the county. The role that they do is they really serve as kind of the experts of the area, where they all live in the areas that they serve. They know a lot of relationship with cities, towns, local organizations. So that's a regional approach. We also have a team that leads that HIPMC group of community partners. A lot of that is, has just grown over the past about 10 years as well. There's a steering committee that is completely, that is formed up of majority community partner organizations. So there's that community buy-in. We have, as a result of the health disparities funding, we have some community advisory boards in several of our different regions, and we have internal staff that help provide that backbone support. And that's really just within our office. We also have so many connections within, our other offices, especially as a result of COVID. Our public health response team has made so many contacts and so many great relationships as a result of vaccination. Our leadership is super committed to working alongside cities and towns. We have a public health fellows program where the fellows get trained at the health department and also support substance use work in our dedicated to each individual city and town to use their opioid settlement dollars. It's a lot of work. We've tried many times to create big Excels and project management softwares to keep track of everything. And I will just say at this point, our biggest strength is just knowing the network internally of kind of who knows who. And so we have a lot of conversations. We use a lot of internal tools, murals, and et cetera, to meet our goals and to try to maximize that distribution. We have a fantastic comms team who really keeps track of these partners and make sure everybody's getting the information that they need as well. So it's a group effort, and it's constantly evolving.
Yeah, but I think I've seen this too in the state health agency where I worked, that as we get more committed to the concept of social determinants of health, the relationship building becomes more complex, and then that really does leave you with a significant issue in terms of keeping track of all those relationships, and because they're so interwoven and entangled. It's probably something that we're going to have to deal with as a field pretty soon. It's not just, data management is not just about the data we collect, it's also about the relationships we build. We have another question for you about how long the CHNA data collection period will last in 2023.
The CHNA data collection will last 3 months. So it'll be from March 1st until it'll close May 31st.
Gotcha. Okay. And then the last question we have at the moment is about, Deidre says, you just spoke about regionalization. What counties are included in your regions? I'm not sure what.
So the regions are actually sub-county because our county is so huge. I'm responding with a, I don't know if it went up there, with a link that basically has, shows what kind of the different regions, but basically we have one region is mostly town of city of Phoenix. And then we have a Northwest region that has Glendale and some of those other cities. Our Northeast region includes Scottsdale, all the way on up to some of our kind of the border of the county. Southeast includes our Mesa, Tempe, Chandler. Southwest includes our Ahwatukee. So they're kind of based on some of our major cities and towns. The way that it was regionalized was based on one of the previous, I believe it was the 2016 or 2017 CHNA, and the responses that we got, and kind of the ways that we saw our services and our outreach kind of best clustered. So yeah, within our one county, we have these 5 different regions because we really need that level of kind of focus and dedication across the board.
Next question that's come in is, this is a powerful advocacy tool. Is your agency doing anything to brief and engage local, state, and national policymakers through this project?
So
You're
I'd say
doing it
this
right
is,
now.
what was that?
You're doing it right now.
Here we go. Yeah, I mean, you know, I feel like we're as the health department, the best work we can do is really use our tools in assessment and kind of that public health approach to services and strategies, and to publish that data, you know, freely, accessibly, and at a variety of levels, so that folks who maybe have, you know, the common community member with not the highest health literacy will be able to see themselves in the data, and also our researchers and our policymakers and our healthcare institutions will see that data. So that's constantly a challenge, trying to find the right balance of all of that. You'll see on maricopahealthmatters.org, we have a bunch of different, we have reports, we have profiles, we have this dashboard. And so we really just try to get it out into the hands of the right people. We love to be able to present our work to other partners. You know, with one of the big roles that our public health liaisons do is, as they go out and really advocate for the collection of data in the communities, we do this thing called like the roadshow, where we go and you know, do a 20-minute presentation about what have we seen in this data, why is it important, what has it done. I mean, this data has directed some of our funding as we've received you know, federal grants and public health grants, that type of thing. I would also say that our HIPMC partners, who are community-based, are really uniquely situated to bring this data forward to our policymakers. We make it available. We try to make it as equitably collected, analyzed, and reported on as possible. And then we do really look for our network of community partners to be the ones taking that and kind of running with it. But we hope to be seen, you know, we have been and continue to be seen as you know, as one of the best resources for understanding, you know, the health needs and experiences of our community, and, you know, are always excited to see that kind of take off into action.
Mm-hmm. Could you actually share an example of how the results of the data collection has shaped the way that funding gets allocated? You mentioned that in your last response, like how it sort of affected the funding in your department.
Yeah, so the 2021 data collection, we really saw some of the biggest impacted community populations by COVID, you know, included some of our refugee immigrants, migrants. We saw a lot of impact on people experiencing homelessness and changes in affordable housing. And we saw a lot of that impact as well in some of our minoritized communities. And so when we developed the community advisory boards to really focus in on those areas, we took that data in order to recruit individuals in some of those specialty areas to put out funding for these community advisory members to enhance the work that they do. So based on the data, we said, here's some of the populations and the target areas we need to focus on. We need to focus on affordable housing. We need to focus on access to care. We need to focus on mental health. And that kind of laid the groundwork for other community partners to apply for data, get funded, and really become part of like a cohort of people working on some of those issues. Another example is with our healthcare partners. We go through this process of prioritizing, you know, the health needs that they're focused on. And so we've seen several of our partners turn around with that data and say, we're going to focus our community benefits dollars on mental health care access, for example. So you kind of see that direct line from the data to what we're going to do about it, where we're going to either put policy or money or initiatives.
Gotcha. Thank you. Well, I think that was the last of the questions in the Q&A. So thank you both very much for being here with us today and for sharing the links to all the information about the survey itself and some of the results that you found. And I think we'll be, if Walker, you wouldn't mind putting up our closing slide, I think we're ready to wrap up. Thank you. All right, Chrissy, back to you.
Thanks again, Tiffany and Annie, and thanks everyone for joining us. This is the last of our currently scheduled Urban Health Agenda series webinar series, but we're hoping to plan some more in the coming months. So do sign up for our newsletter so that you can be among the first to know of the newly scheduled ones. So thanks so much and have a great week.